Okay, so in terms of factors that can affect the reliability of the tests that we undertake, if we take hair, for example, hair chemical treatments such as bleach and hair dye can actually damage the hair and reduce or lower the levels of any compounds that are present in the hair, such as the drugs and the alcohol markers. So if somebody is a regular user of drugs over a period of time and they bleached or chemically dyed their hair, that could lower the levels that we would see in the hair strand or the hair sample. Now, if somebody was a regular user of substances over a period of time and did bleach or dye the hair, we should still be able to see the compounds, the drugs in the hair, but just at a reduced concentration. So if somebody does chemically treat their hair, the test is still accurate, it's still sensitive, we can still detect those substances, but just at a lower concentration. Now, in terms of medication affecting the hair results for the drug analysis, the test that we do is very sensitive and specific. So if we see a particular drug in the hair, it can only be that drug and it can't be anything else. So any medication wouldn't give a false positive for the drug, for example, cocaine, that we've detected in the hair sample. If we detect cocaine in the hair, it can only be cocaine and it can't be anything else. So medications such as codeine, for example, wouldn't give a false positive result for cocaine. Now, in terms of the blood tests, the CDT and the PEth tests are very alcohol specific. But these are biological tests, and the same with the liver function test. So with the liver function test, certain medication can elevate some of those markers. So it's best that the medication is declared at the time of the sample collection, but there's 3 markers that we look for in terms of the liver function to help assess chronic alcohol use. Now, in terms of the SCRAM, with the SCRAM continuous alcohol monitoring testing, again, the device is very specific to looking for alcohol, and it can tell the difference between consumed alcohol and environmental exposure to alcohol, such as using products containing alcohol in and around where the bracelet is fitted. So with consumed alcohol, we get a very nice smooth curved peak going upwards and then tailing off to show that the alcohol has been consumed, ingested by the body, and then excreted through the skin via sweat and detected by the SCRAM bracelet. In terms of exposure to alcohol, we get a very different reading, very different signature of that. So we can tell the difference between the exposure to alcohol with SCRAM and consumed alcohol.